afternoon, everyone. October is the breast cancer care month, and we want to focus on how natural therapies like Ayurveda can help with management and prevention. Presenting this topic, we have Jaisri Lambert, who has been an Ayurveda educator for the last 25 plus years. Jaisri has developed a deep knowledge of Ayurvedic herbal formulations, wellness programs, pulse assessment, and Panchakarma, and many more. I am Amita from Nourish Doc, a global platform for natural and holistic therapies. I'd like to introduce all of you to Jaisri Lambert, who's joining us live from Canada. Welcome, Jaisri.
Thank you so much, Amita, for this wonderful invitation.
Great. So let's get started on just the basics of what Ayurveda is, and then we can go into the management of in cancer care. You can start.
Okay, well, we know that Ayurveda is a Sanskrit term meaning it has two roots, Ayu, which means continuous life. If you notice the vowel to begin and the end, they're all three vowels. Ayu means that it is a continuous open phenomenon. In Veda, the knowledge, the systematized knowledge being science, so we usually translate it as the science of life, and it is the most ancient and complete holistic medical system extant today. World Health Organization is well aware of Ayurveda, and Indian government has created the Ayush Ministry for Ayurveda and related natural therapies. So as the world's oldest holistic medical science, I feel it has a point of reference to offer in any of our modern challenges, and certainly our prevention and management of disease, very critical. Ayurveda has the broad knowledge, thank heavens. Now, in terms of how Ayurveda views the dietary factors, naturally a food program that avoids cancerous materials is called for. Now, look at the grocery stores today. Most everything in that store, if you go into a Rayleigh's or any, you will find most everything is packaged, maybe with preservatives. You will find a huge meat section. And of course, the dairy industry, meat industry, beef industry has been very active in promoting their products. The problem of mass population feeding led to this chemical pesticides and chemical substances used in agriculture. So these, of course, are disturbing to the cellular integrity and therefore can cause these abnormal cellular changes or cancerous changes later on. You know, cancer is a disease that occurs very slowly, gradually, first with 1, 2, 3, 4 cells, and then it can encompass more cells. Now we'll see later on in our discussion how the Ayurveda immune building program can help prevent. And I myself am a daughter of a breast cancer patient. My mother had a mastectomy in her 60s. And every disease that she had in her life, I had at the same junctures in my life until I encountered Ayurveda in my mid-30s. From then, there's been no hint of breast cancer, even though I look exactly like my mother. So lifestyle plays a huge role. Emotional factors play a huge role, but we have to get away from preservatives. We have to purify our municipal water supplies from the chlorination. We have to avoid these hormone replacement therapies or chemical therapies and favor a plant-based lifestyle. There are many things that are known to cause abnormal cellular changes, among them white sugar, coffee, and any genetic modifications. For example, if you buy grapes, seedless grapes, any seedless grape is genetically modified, because where are those seeds? Have they been bred out? Goodness, to breed out the artiva, the reproductive system of the plant. You know, really we have to think about the philosophies behind it. Certainly aluminum products, preservatives, these are rampant on our shelves, supermarket shelves. So I do encourage people to favor their farmers market, their organic growers, their healthy providers that are not using plastic containers for their distributing their products. So we want to avoid these causative factors and also see that in the environment, there's a tremendous amount of disturbance from, okay, we're having our new G5 now. Most people will tolerate it okay. Kapha people that are stout, sturdy, they can tolerate. Even Pitta people during the prime of life may not have too much disturbance from G5. But Vata people and people in Vata age and with Vata pre-existing conditions, they will be disturbed by the new G5. And where to get away from it, that will be the question. Naturally, we have our carcinogenic emissions from vehicles. We have golf courses that are known to be carcinogenic because of the tremendous amount of chemicals that are put on the lawns every single week. So look for an organic golf course, encourage your golf course to become organic, and it won't take long before the cost savings are seen. So there are other problems as well, the industrial dumping, even fireworks. Fireworks is very scary for animals, birds, and I'm not sure why it is considered delightful, honestly. To me, I just think of the noise pollution as well as the debris raining down on the waters or the land or the viewing area of fireworks productions. So these are all things, although they're, you know, we can't be against everything. We have to be for most everything. But in the same time, we really have to discriminate, and hopefully this dialogue will help us discriminate on some of the causes. You know, the idea that women's breasts should be lifted and separated, and they should be perky. These are modern ideas, and they do not serve the feminine principle in the creation. So bras as a whole are not conducive to free flow of energy in the meridians that affect the breast tissue. Another common influence for abnormal changes in the reproductive system is to go ahead and work on the menstrual cycle, the flow cycle. On flow days, we are meant to rest. We have to rest because rest is recommended in the medical scriptures of Ayurveda. Rest is required because the aura of the menstruating woman is open, and she is therefore very prone to undue influences. So for protecting her immunity, she should be resting on the menstrual cycle. The flow days means that when Dr. Ladd was asked by many women over the years, what do you mean rest? He said rest, rest, read, relax. So, but we want to do this webinar, we want to do that gardening, we want to do all these activities that may be excessive. So a very important principle of Ayurveda for management of energy, personal energy, is to work for livelihood to half the capacity. Working for livelihood to half our capacity means first we need to know our capacity, which is something to discover. So once we know our capacity, it'll be less on the flow days, less on bad news days or rainy and cold days and change of season. But generally, in our world, Having sex on the flow days as well is disturbing to the downward flow of the menstrual cycle. And perhaps the woman is doing suppression of grief, sadness, anxiety, stress. If those molecules are suppressed, they will surely enter the digestive system and the Dhatu formation system, the tissue formation system, according to Ayurveda. It will surely happen without care and attention, because there are many grievous events, many anxiety-provoking events, but everything in this world is temporary. With meditation, we can rise above and have a communion, because meditation is not a religion. It is not any personal belief. It is simply your own personal relationship with the divine. It's very personal, very individual, very private, and very much yours. In other words, you have the responsibility to engage in that communion, the meditation, emptying the mind, inviting the divine essence every single day. In doing that, immune molecules are strengthened, reproductive secretions and structures are also strengthened. So many, many benefits just from meditation alone, which costs nothing, just time, 20 minutes, 40 minutes, 60 minutes. Enjoy, take time, this is your time. Very important investment to avoid these problems and to be aware how to avoid. So cosmetic surgery, it depends. We have these breast removals and reconstructions. So now the idea is that you take a muscle from here, just take the muscle, take the insertion, take the attachment, take the origin and place it somewhere else under the breast. And now it's going to look like flesh, your own flesh. These rebuilding concepts, truly it is going back to our societal interpretation of breasts as symbols, right? So if we find these ideas, people thinking professionally, oh, how can I deal with this problem? Oh, I know, I'll just take a piece of her body from here and transplant it there. So these are, of course, we have to think these things through. We can't just think mechanically that this is a logical approach. We have to think about the entire picture of the human being, their soul, the psycho-emotional factors. The physical factors are lost to manifest. Naturally, if there is abuse, if there's a history of violence, naturally that woman will require more care to overcome the trauma, rise above. She also has the light as her parent, right? Her friend. And this is where meditation is really a true path for each and every person. Of course, we do our own style, our own way, but some time dedicated out of 24 hours given by the divine bestower of life, why can we not give back at least 1/10 or even 1/5 to meditate more? Because if we do undergo the surgery, we'll now have an incision. The incision will disrupt the meridian system, the invisible anatomy of the body. Radiation, we know, is a toxic exposure. Of course, in Ayurveda, also toxic materials are used as medicines. They are called slow poisons, and they have their antidotes. So anybody undergoing radiation therapy can take their Ayurveda program along with and reduce any negative effects from the radiation. Let's say mitigate. So we see these synthetic materials in so many departments of life. Drugs, for example. Have you seen the pill book? The pill book is published by governments to describe all the pharmaceuticals that they allow. And they're being responsible for public health, and they're allowing these materials with side effects. Our medical scriptures from Ayurveda describe that a medicine is a substance that removes the disease without causing harm. If there are side effects, then this substance is not a medicine. It is called a slow poison, and we have to then follow the rules of management of slow poisons as medicine, because we use aconite at times. Even iron in its raw form is entirely toxic, even gold, silver. These by themselves are not digestible for the human being, but as they become food grade, and Ayurveda has figured this out, how to render these heavy metals food grade, then they become medicines, amrit, nectar. They do the job in a very subtle way. So I just feel like this world, this society we're living in, we do have isolation. We live in our little matchbox. If we see the new buildings going up, you might have 20, 30 floors of little individuated apartment homes. So very isolated society. The power of the ordinary woman or the ordinary seeker may seem little, but that's really, I think, unimportant in my experience. And the important source of power is the meditation. So power is not for bullying, it is for leading. So power is a very important healing path for many women, and certainly those with breast cancer who have developed a disease around their most beautiful, can we say, of structures.
So, okay, so let's talk about, I think a lot of people might not know the Vata, Pitta, and Kapha. So maybe you can talk about the tripod of life, what exactly?
Beautiful.
Yeah.
Yes. So thank you, Amita. That's tripod of life in Ayurveda refers to these terms Vata, which is mostly ether and air element in composition, Pitta, which is mostly fire and water element in composition, and then Kapha, which is mostly water and earth elements. So these are our tendencies to be endomorphic, ectomorphic, mesomorphic. There are other ways to classify the blood type, always mostly Pitta. So the various ways that we classify the metabolic type. And these then are Vata, which is very fast metabolism, tends to be very thin. Pitta woman who is more prone to breast cancer. Pitta and Kapha women are more prone to breast cancer. Pitta because of overwork, and Kapha because of overeating. So this Vata, Pitta, Kapha are all operative in each and every one of us, but some are dominant. Some characteristics of Vata, Pitta, or Kapha are dominant. Also, the characteristics of Vata, Pitta, and Kapha govern the disease as well. We can identify the disease through its direction, its strength, its relationship to the full history. So I hope that explains a little bit about those terms, Vata, Pitta, Kapha.
Sure. And you've explained it here also, what the qualitative expressions are as far as cold and cool is Vata and Kapha. I mean, there's a whole list, but we probably won't go through all this right now.
Yeah, no, I think these qualitative changes, these opposites, cold, hot, dry, oily, light, heavy, sharp, penetrating, subtle, gross, all these pairs of opposite gunas are worth understanding because they are the very means of equilibrium.
Yeah. Okay.
Yeah, and I think for example, there are certain types of breast cancer that are more spreading than others. So that means more Pitta management, you see. When we see the lesions from the outside, many times would be red color, bumpy in nature, purplish color.
Okay. Should I move on to the next one?
Yeah, I think we mentioned about the qualities. We can go back to that, of course. This is the most important part of our lesson today, these 7 tissues, the Sapta Dhatu concept. This is the way where we're going to understand this zany concept of breast cancer through Ayurvedic eyes. So let's sort of take a bigger view for a moment. The creation, according to Ayurveda, was arising from a concept called Purusha, the pre-existing, or God, or conscious passive awareness. There are many ways to define this. Purusha, Sapta Purusha, which is the essence of the human being. It's our origin and destiny. Now, as the creation precipitated itself into Prakriti, the manifested nature, the manifested material world, which is Prakriti, the Mahat, or universal order, was the first result from this sort of Big Bang concept or explosion into life. And these then generated ahankar, ahankar being the individuation. So now we have an individual, and that individual is born by the merging of the egg and sperm. So at the time of conception, the person's Prakriti is set. Their psychobiological nature is already set. So then the gestation occurs, hopefully without any untoward experiences. Then the birth takes place, again, hopefully uneventful, normal, and then the child begins nursing for the first year, 15 months. Nowadays, that there may be exceptions to that, but that would be the normal course of events. So now in the creation model of Ayurveda, the Prakriti generated into Mahat and then precipitated to Ahankara, the individuation, and then came the Tamas Guna, the body itself. So body itself, these are the 7 tissues. Let's really learn these 7 Sanskrit words if we can. Rasa is the plasma, the skin, breast milk, and it's also the menstrual output, the menstrual fluid that is collected with a pad during the flow days, not a tampon, by the way, which will create a retrograde situation for a fluid that is meant to be flowing downwards and outwards. So this Rasa Dhatu, the plasma, is the first generated from the food we eat and the thoughts, feelings, and emotions that circulate in the general circulation. So the mental factors are probably more than the digestive or nutritional factors. So now we have this rasa, this light part of the blood, clear part of the blood, the plasma. And then after 5 days or so, it precipitates into the Rakta Dhatu, the blood, the actual heavy parts of the blood, which have more fibrin, more red blood cells, T cells, etc. So Rakta, the blood, is rooted in the liver. So blood supply, if there are any blood disorders at all, breast cancer being one of them, then liver has to be restored properly. Fortunately, liver will restore easily. Rakta is manufactured in the liver, but the liver itself belongs to Mamsadhatu, which is more muscle, right? The liver is a pulsatile organ. It is contractile at times and relaxing at times. It has components which are always in touch with one another. And it's also the site of synthesis of hormones. So something has gone wrong here within the liver parenchyma, within the Mamsadhatu, where abnormal cells began. So now we're into about 15 days after eating. The food we eat, thoughts, feelings, and emotions that circulate through the consciousness first precipitate into the rasa qualitatively, then qualitatively precipitate next to the rakta, creating blood quality or not. Then, of course, the mamsa, the muscles, the tendons, the tendinous attachments, those are next to be precipitated from the food we eat. So now we're at 20 days after ingesting a particular meal. Then metadhatu, the adipose layer, which can be the yellow fat, brown fat, white fat, all types of fatty deposits. And these fatty cells are meant to buffer. We will find toxicity stored within the fatty layer because fat is quite a safe place to put toxins. They can be stabilized and not bother the owner. Now we're going to the next dhatu. After the Meda dhatu, the adipose is formed, precipitated, then Asti dhatu, which is the bone. Bones are precipitated. So now you can see it's the third to the deepest level. Asti, the bone, the structure, the joints, the rib cage, all the bony structure, including the bone lining, which is periosteum, including the shaft of the bone, but not including the marrow, which is next. It takes longer to produce marrow. So Asti Dhatu is very much affected by breast cancer. We find that all these Dhatus, Rasa, Rakta, Mamsa, Meda, Asti, Maja, the nervous systems, are all affected in breast cancer. There's disturbance throughout. Now, with any cancerous change, any abnormal change where the cells have gone a little crazy and invited all their friends to join the abnormal army. Now, Majadhatu, this is the critical one to understand for breast cancer. This is the bone marrow, the connective tissue, right? Keep in mind from a yoga point of view, connective tissue stores our past life karmas and unfolds them during our lifetime according to the pralabdha, the destiny schedule of the life. When we meet the guru, when we meet the partner, when we travel, these are destiny karmas, so-called. And Majadhatu, the bone marrow, is the carrier of these unfolding karmas. So very deep-seated. That's another reason we need meditation, because how can we realize this otherwise without a very subtle and consistent attention to our inner workings? And finally, we come to Artava, the female reproductive system. So it includes all the structures of the female reproductive system, all their secretions, their contents. And you can see how all dhatus appear in Artava, and all dhatus also appear in Rasa, but there is a dominance. So the Artava is the site of this disturbance. You can see that it will take a long time. It will take longer to retract this pattern of abnormal cells back to healthy cells, using, first of all, the palliation of the dosha, which is following the doshic program to avoid the previous causes, and also the Panchakarma, the cleansing and rejuvenation science, which we can consider later at a right time for the person. Yeah, so
that's quite a complex thing, to understanding the dhatus.
It is. That's why we want to take those 7 words and just really learn those words on this lesson here today. This class discussion today is to really go to, you see the Sanskrit terminology, rasa, for example, it carries a great meaning. And when we repeat that term, rasa, rasa, it really goes to a tremendous understanding of our enjoyments of life, our preferences, our genetic tendencies, as well as our soul tendencies. We can feel it in the plasma. It is there circulating as personality.
Okay. All right, moving on. You want to talk about a little bit on the female reproductive system before you move on to how to manage?
Yeah, so this female reproductive system, of course, it's not separate from any of the other systems, but rather integrated. I think in Western science, there's a tendency to isolate the system as somehow separate. And perhaps that gives a certain clinical ease, I don't know, but in no way is it separate from, it's absolutely integrated into the entire life of the person. I think we can understand that. So when the little girl is in the womb, she will develop her gonads, after even such a short life of 6 or 8 weeks. We can tell already from the ultrasound, is the child a girl or a boy? So already there are very significant distinctions. And the mother carrying this child may or may not know that the child is a female child. If the mother knows, and it's quite knowable up to, say, 16 weeks of gestation, and this is where we get the infanticide. This is where, as women come to know that they may be carrying a girl and not a boy, in some cultures and in some countries, it's permitted that they abort the child.
Mm-hmm.
So even in Canada, there are ways people that get around our medical system and manage these female infanticide, abortions. Now, so let's say that there's a happy gestation, a happy birth. The girl child is born with all her ovaries ready to mature, all the eggs ready to mature at a particular timing and trigger, because Sapta Dhatu regulates the timing of these triggers. Do you remember the reproductive system, the marrow, the nervous systems, endocrine system? These are the governors of how and when diseases unfold in the person.
Okay.
So definitely the entire system is affected by any abnormal cells in any one part. So it could be breast cancer in this case, could be ovarian problems, fallopian problems, it can be the uterus itself, the lining, the endometrium, So any of these operations, any of these normal functions can go awry, especially if we don't rest on the menstrual cycle, especially if we have a high sugar diet, and especially if we have unresolved emotions, particularly sexual emotions.
Mm-hmm.
So this Artava Bahashrotas, the female carrying channels, are truly the location where this life experience now begins to manifest. So we cannot think of it as just a group of abnormal cells. They are within a human being, and that human being has a soul path, a life path, and that, again, it cannot be separated, I don't feel, from anything. It really is the total story. If we come and present with a reproductive issue, it's really our entire being that is coming with that problem. Many times our hormonal secretions are interfered with from, maybe the person is eating meat that has had hormonal injections. Perhaps it's milk. This used to be quite common. We used to see the young girls getting breasts when they were 7 because of drinking carton milk or drinking milk in plastic bags full of hormone disruptor chemicals. So these are inevitably irrigating our reproductive system of our youth. So we really have to train our young girls how to remain healthy through the teenage years, through the onset of the menstrual cycle, through the period before they're settled in a relationship, which may mean quite a while in life. It could be up to 30 for some women if their parents are separated or if they've lost one parent before adult life. Now, the breasts themselves are a very intricate and wonderful network. It's amazingly beautiful. Can I show you a little picture, an illustration?
Sure, absolutely.
Okay, let's see if we can get this to.
Yeah, you have so much knowledge that I think we need to have a lot of sessions on this topic. This is like, we have only 1 hour, but this is so beautiful. Oh my God.
Well, hopefully we can get a lot conveyed in just an hour.
Yes. This is beautiful. This is a beautiful illustration.
We can see exactly. Now, why would we put a bra? around
Yeah.
that and make it point here or there, and scour the shoulders and the mid back and disturb so many structures with a bra. Do you
Yeah.
see? When you
Yeah.
see the sameness, to me, how can you bind it and make it? It just shows our society's philosophies.
Correct.
So
Correct.
we are the ones who need to change our society's perceptions.
Mm-hmm.
Nobody else will do that. We have to step up and do it.
Yeah.
So these very complex breast tissues are very related to sexuality, maternity. If there are unresolved issues with maternity, particularly nursing as a child, it really translates to the degree of maternal care or not, more so than the actual breast milk. So their function is very focused on reproduction. The nipples themselves have these marvelous ducts that secrete the milk. Right away after the child's born, the breasts will begin secreting a specialized fluid, colostrum, that will keep the baby's immunity very high until the milk comes down. So maybe the third day after the birth, the milk comes down into the breasts. The breasts become heavy, full of milk. It's amazing how this happens. And there, all nourishment for the baby is already planned well ahead. So nurse the child for 12 to 15 months, no longer, but no less either, so that the child has that mother and baby bond, and that it's maintained. Now, with that small point about if we see the hairs around the areola, many times women will find that they have small hairs emanating from the circle around the nipple, and those little hairs correspond to thickening of the endometrial lining. So it's a wonderful diagnostic tool to know that we have some, according to the number, and whether they're fine hairs or coarse hairs, colored hairs, white hairs. It's very telling about the conditions of the endometrial lining. So if you have little hairs around the areola, do go and meet with your Ayurvedist soon and be consuming those substances, corrective substances that will help to reverse that endometrial thickening. I believe in phytohormones. You can probably tell I'm not that much at all into chemical medicine, rather avoiding and using the God-given medicines. The Ayurvedic scriptures tell that they were provided before humanity. I love that. Reading these ancient books, scriptures that tell this Ayurveda was generated first by Indra, the god, right? And then by certain incarnates, so certain people that incarnated to receive the knowledge from the god of the senses. And then later it falls now under the Sri Dhanvantari, the god of healing, who is responsible for, and that's why we do prayers to Sri Dhanvantari, that agency. It's just an image, agency of healing, that part of the universe that is specifically deified for healing purpose. Yeah, so I have found in my own life and in general, I don't think there's any self-care strategy better than meditation. It's free. It's your freedom as well. There's no dogma there, right? You are just closing your eyes. You're having your inner communion. That's all. You are watching your breath. You are watching your mind. You are watching your life. And pretty soon it will rise up by itself, because the power of magnetism to the higher planes is so prominent and so inexorable, so inevitable, that we come to it eventually. You know, a lot of person sits for meditation and says, oh, I can't meditate, my mind's too active. Well, slowly, everyone's mind is too active in the beginning, and then the mind becomes trained to settle into a particular repetition, settle into a particular emptiness, and all insight comes from there spontaneously. This is a tremendous method, I think, that really crosses all boundaries, all borders, all restrictions, and provides, you know, meditation as a direct communion with one's own true self.
That's beautiful. That's beautiful. So let's talk about the food choices, because we have today a very limited time, but I think we should do a full workshop on this.
Yes, the food choices. Naturally, we have to avoid all known carcinogens, chlorinated water among them. So the chlorinated water, really, we need a shower filter. It can be a very inexpensive carbon filter that's changed every 6 months. You know, but in some way we have to avoid ingesting chlorinated water through the skin and by mouth. So we also need to know about the food and how the food was grown. Was the food grown with integrity, with composting, with effort, with awareness, with dedication? Or is the food produced really, the sale is the one and only purpose? Really, we have to think about the ancient principles of welfare. One of my teachers of Ayurveda, Dr. Sukumaran, taught me this from Kerala. He said, in Kerala, we grew up, we would pray for every family within 100 kilometers. Do they have everything they need? If they do not have everything we need, because we're meditative people, so we know out there in 100 kilometers who is in need, then we go and provide that person food and then go on with our eating. That type of attitude as well is a little bit lost today. So as we revise these in our own personal lives, really there is a health that generates from that, a happiness, a radiance, and that does eschew and dispel the darkness, the negative effects. And you look at a cancerous cell, it is dark, black, right?
That's
so
right.
Like a black hole.
Yeah.
So it needs light. It needs light, and that is the meditation. Meditation is the light. So yeah, along with the reproductive system is, of course, the lymphatic system. Very critical for cleansing toxins from the body. But if we notice a coating on the tongue in the morning, then we know that the lymphatic system has not cleansed itself properly overnight. Only if the tongue is clean, then we know that toxins have not accumulated overnight in any part of the GI tract or further. So if you do want to wear a bra, at least wear a soft bra that crosses in the middle and does not pinch or leave any marks after removing it. I also believe a great deal in walking as the principal exercise. Of course, yoga, Tai Chi, dancing, these are all excellent. Dancing is so good because it's a partner activity, and breaths are very related to partnering and relationship and loving communication. So dancing is that. It's fun. And in fact, sometimes I use it as an image of life. Life is dancing. Partnership is dancing. It means we're supposed to be having fun. So find a way to have fun with your daily life, with your sweetheart. So lymphatic circulation has to be a purpose of yoga stretching, stretching up, stretching down, stretching around, so that you feel energetic, so that you don't feel any little kinks, little niggling pain zones. If so, deal with it and go back to normal, because any lymphatic congestion, first of all, it's not going to cause pain. It'll only cause discomfort, bloating. Only later it will cause pain. So act early.
Okay.
You know, massage therapy is generally contraindicated for spreading conditions. This is something quite unknown in the West, I've found, but it is one of our medical contraindications for massage therapy, is a spreading condition such as a rash or infection. Now, this breast cancer is a spreading condition. It may be undergoing slow spread, but nonetheless, it is happening. So we need a breast self-massage care measure. And the castor oil is a wonderful way to just isolate the breast, just put the castor oil, good quality, no preservatives, put it in the right hand, it'll warm it up, apply the oil outward and upward strokes into the axilla area. Do it gently, don't cause any pain, and that will help reduce cystic changes, which result from perhaps precalcifications, and the castor oil helps to metabolize these small deposits and retract the cystic formation, which will otherwise lead to fibrotic changes and later cancerous changes possibly. So overnight, when you put your castor oil just on the breast, then just put an old cotton t-shirt so that you're comfortable to sleep and your sheets don't get spoiled, and wash that old cotton t-shirt separately so it doesn't make the oil smell transfer to other garments. So this breast self-massage helps with various kapha and pitta conditions and does help to retract spread, retract swelling, redness, irritation, inflammation when applied externally. Castor oil has different properties externally and internally. So this is the external use for breast cancer itself. Now, if there's incisions, don't apply any oil. Too much danger of bacteria entering an opening. So if there's an opening, an incision, just keep it carefully dressed, carefully safe until it heals over, then only apply the castor oil. So right use of time, this is an interesting one because, I was raised Westerner, and this is when you do this and this is when you do that. But Ayurveda takes this right use of time to a very subtle and important place, which is that if we rest on the menstrual cycle, this is a good use of that time. We have to rest because the woman has to take some time not to be constantly working and serving others. There has to be a little time for herself to regroup and restore her aura. So timing is very important. Timing of eating is very important. To eat when you're hungry and not when you're not hungry, because it's time. Oh, it's my break. I'm going to eat now. Are you hungry? Well, no. So eat when you're hungry, drink when you're thirsty. These are very important concepts from Ayurveda that tend to simplify what we've learned in our modern Western culture, which is maybe 12 glasses a day, like that. It's too much. You can't digest that. It's, as long as you're thirsty and you drink to that thirst. Some people will argue, well, you don't feel thirst on the tongue until it's too late. We know that we need to drink water, not pop, not carton milk, not coffee, not, colored beverages with synthetic color. Water, take hot water, so good, so simple, so available. Hot water, boil it, make it light, and that hot water is very satisfying to the thirst. So always eat when you're hungry, drink when you're thirsty, do exercise in the morning and not the evening, because morning is for activation, evening is for winding down. Get to bed very early so that you get up early, and that will bring happiness. If a person has anxiety or depression, let them get to bed early and get up early. First line of management, because early morning is the sacred time. It is the Amrit Vela, the time of the nectar of the divine. So a spiritual person seeking inner realization will want to do that communion and use the time available in the lifespan for appropriate use. So I think this right use of time, that is an important discussion, and how we misuse time in certain ways. Studying till midnight, 2 o'clock for the exam. No, study during the daytime and get your rest at 9 o'clock. Do your meditation. Remember the stories of the saints who have told about their experiences with sleep and meditation.
That's beautiful.
Thermograph. I believe that a thermograph is a better choice than a mammogram. A mammogram squishes the breast. If you're in a spreading condition, if your particular diagnosis is in situ, estrogen dominant, the spread is imminent, even occurring. So we don't want to squish the breast at that time, very critical time. A thermograph does not use any pressure. It's a heat based measure, as you can see from the name. It will measure the temperature and it depicts it in colors: red color, blue color, yellow color, etc. And then you read the test, the thermograph, and truly there's way more information than a mammogram. And not only that, but it's much more positively framed. These are the things you can do to help deal with this situation.
Okay.
Mm-hmm. So yeah, relationships, this is where breasts are the most intimately placed, is in the love relationship. Oh, do you think my breasts are beautiful? Really, this is a cause of divorce at times. Really, tell me you think my breasts are beautiful. If you don't, I don't know. Therefore, I'm going to divorce. Do you know what I mean? We can get into these headspaces. So breasts are very critical. Now we have to see that every body part is sacred, right? The bowel movements, every single aspect of life we have to see as sacred. And certainly relationships, absolutely. We're not in a relationship to get our needs met. First of all, if we go into the relationship to get our needs met, how can our needs be met from outside? We have to meet our needs from within, from our own consciousness, our own consciousness.
Okay.
So I think these are.
Yeah, so I think we are on the Panchakarma, or the Ayurvedic cleansing now. We have actually only 4 minutes left. I don't know what we can do, but we can extend it for another few minutes.
Oh, I think we're good. We'll be able to speak about it enough in that time. Because Panchakarma, first of all, the meaning, Pancha means 5, Karma means action. These are the 5 actions of cleansing and rejuvenation. If a medical doctor is going to study Ayurveda, let them study Panchakarma, because they already have a lot of preliminary knowledge of anatomy and physiology. Once they learn their basic Ayurveda anatomy and physiology, this Panchakarma becomes the province of the senior practitioner. So to go to a young practitioner, brand new graduate, not enough experience. This is a serious undertaking, and it must be properly timed. It must have all the proper materials, timing, support systems. These are all written in the medical scriptures. So in order to get the desired result, we need to plan it in a particular way. There are preparatory therapies. There are the actual cleansing therapies, and the 5 are the Rakta Moksha, bloodletting, which is not used that much today. And it's just a little bit of a leech that induces a small little stream of blood that refreshes the spleen and refreshes the whole hemopoietic system. Then there's, let's see, where are we with 5? Then there's the Basti, the enema therapy, which is mostly for pacifying vata in the colon, We have Virachan, which is the laxative therapy to remove pitta from the small intestine. And we have Vamankarma, which is the emesis therapy, vomiting therapy, which is for eliminating kapha from the upper channels. So sometimes in breast cancer management, we need to do one Vamankarma later, not in the early stages of recovery. So now, what are the others? Basti, Virachan, Raktamoksha, Nasya therapy, which is the nasal administration. So nasal administration, the nostrils are considered the doorway to the brain. So the nostrils are considered as avenues of administration of medicines for diseases above the clavicles, particularly. And because the thyroid, breasts, really this entire relationship has to get cleansed and really reformed from the prior tendency. So Panchakarma is that powerful that it can accomplish this. Now it's slow, it's gradual, it's gentle, it's very scientific, it's very effective, tried and true. Thousands of years, these karmas have been performed with great success in India. And I would mention just on a closing note that the Indian management of COVID by country doctors, Ayurveda doctors, has proven much better than any, hospitalization management with intubation and so forth. So, yeah, that's just a little aside. Now, just closing with our couple of herbs and herbal substances. Of course, use any of these under supervision. If it's new to you, please get more information before you start taking any of these. Neem is known to be an anti-cancer herb. The purified guggulu, Shuddh guggulu, is for removing tumors. Red clover, chaparral, burdock root, and dandelion are all Canadian and North American herbs, all anti-cancer herbs because of bitterness. Flax oil is a helping factor to reduce pitta and kapha. Barley grass is also very useful as a proactive oxygenator to remove the effects of abnormal cellular change. Oregon grapefruit is our local liver restorative plant, grows everywhere. Aloe vera has certain estrogenic and progesterone precursor properties. So we have to use aloe vera gel very thoughtfully in every case of breast cancer, if at all. So bitter taste is the phenomenon that removes these abnormal cells, metabolizes them, and allows the normal cell to restore. A bitter taste, oxygenation, these are the ways. So yeah, we're just concluding now that these are not the only methods available to someone seeking help, but truly this Ayurveda is tried and true. So let us go ahead and learn more and more and more so that we can trust what we're learning and therefore apply it effectively in our own lives. It does depend on us to teach the future generations how to live in these times and not take on so much toxicity and impurity from the environment and the society we live in. So I hope this helps to understand the general process.
Yes. So we are open for questions. If anyone in Zoom wants to ask a question, and these are education sessions. I forgot to mention it in the beginning. So we just do these educational sessions. But cancer care, for example, is a very sensitive topic. We always recommend that you seek professional help. But these are educational sessions. You're welcome to ask any questions if you like to do so right now. We are on above the hour. If there are any questions, you're welcome to put it in your chat window or ask questions. I think it's beautiful what you said, and what I think what would be interesting, or maybe we can have some other session of someone who has already gone through chemotherapy, somebody, you talked about a lot on the prevention part of it, right? Eat the right food, but someone who's already is a breast cancer survivor now, right? They've already gone through chemo, they've already gone through all that. So meditation is one of the things, and what else can they do? It would be a completely separate topic that I think you talked about herbs, you talked about a lot of things. So that's something I think would be very useful for the cancer survivors, not someone who hasn't gotten it, but
Yeah, that's true, because we need medicine at that time. Just the food program alone is not enough. Normally the food program is plenty to prevent problems, but once a problem occurs somehow, then the herbs, I feel, are the way to help retract it. Why do I believe that? Because I see them as the God-given substances.
Yeah.
It's a question of really, can we understand them enough to use them effectively?
That's right. That's it. There is a question today. I don't know where you are from. She's asking, how can I get an Ayurveda doctor? Where are you based? Do you mind telling us where you're based? We're happy to, Nourish Talk has a lot of Ayurveda doctors. Dr. Jaisri, she is from Canada, but where are you based? If you can let us know. I think Alabama. Okay, we can, if you don't mind sending us, I don't know, Jaisri, do you do consultations online right now?
I do the distance consultations, yes. And our National Ayurveda Medical Association in US does have a roster of qualified individuals. And on that site, National Ayurveda Medical Association, nama-ayurveda.org, they will then...
we can refer you also. We have a lot of people in our network, or NAMA. But if you don't mind sending us an email or giving us your email, I can put our email here, and we are happy to, and if you don't mind long distance, then we can direct you to Jaisri, Dr. Jaisri here as well. So feel free to send me an email, and we'll help you. Any other questions or comments? Thank you. Okay, I hope you found this session useful. Please give us the feedback anytime. We are here to help really advocate natural therapies with evidence, with outcomes, with science, with research, and so that's what our goal is. But I honestly think that I think we should try to do these type of sessions maybe later during the day, like we were talking earlier, Friday, when people are not working, or even over the weekend, so that more people can join, and we should try to give it to some of the breast cancer survivors what to do when they've already gone through all these, they're on medication, they've gone through chemotherapy. So yes, meditation is one of the things you mentioned, but what other things that can they do to mitigate some of the side effects? That's something.
We definitely need a good food program, organic foods, pesticide-free foods as much as possible, sprouted foods. When that can't happen, there's always a way.
Yeah, no, what I think what would be interesting if someone is a cancer survivor, you talked about Panchakarma, right? Is Panchakarma is okay? If yes, what are the Panchakarma therapies that are okay for someone who's a breast cancer survivor? I mean, I'm just trying to think through the questions, someone might have, because, they would, and if yes, Panchakarma therapies are perfectly fine because they are actually, cleansing, it's cleansing the body. Which ones are they allowed to do or not? So these kind of questions, I think a lot of questions. Yes, you will be able to watch this again. We are going to be putting this up on Facebook, as well as on our website, as well as on YouTube. But if you send me an email, I'll be happy. If you want to consult with Ayurveda doctor, we can refer you to Dr. Jaisri here or someone else close to you. No problem. Any other comments or questions from people who have joined Zoom before I wrap up? Anything else before I wrap up?
Well, I'd like to thank you for your kind attention, all listeners from here and there, sending good wishes, and special tip of the hat to you, Amita, for creating this forum. Thank you.
No. We are just trying to help. And I think thank you so much for saying very informative. Thank you. I think it was an excellent session. A lot more women want to know what you just said. And I think the next session would be someone they are cancer survivors. So you and I will talk after that. But I really do want to thank you so much for sharing your knowledge from bottom of my heart. Thank you so much. And thank you so much for attending, all of you. And please feel free to send me an email. Again, my name is Amita from Nourish Talk. Thank you. Bye-bye.